there are reasons to continue doing what we're doing well everywhere in the world, to continue implementing the policies that work. And then there are reasons to be worried. And I'm not looking just at the tourist season, which is so important in Spain, but also at the schools opening in September. It's not going to be possible to open some schools in some areas unless the situation is under control.
Can you talk to us about first and second waves of the virus? Because from the start, we were talking about this big explosion in cases, the first wave, and then you got the sense that that starts to tail off and we prepare for a second wave. But in recent weeks, very mixed messages, some saying we're still in this first wave despite further clusters breaking out in various places like Hong Kong that seem to be through the first wave. Where exactly do we stand on these waves? Because it makes it very hard for populations to plan if they don't know what they're facing.
It is true that you're right, Karen, that the population, sometimes citizens are sometimes confused, but I think it is clear that the areas where the public health authorities are allowed to work and the population is following, we are following the instructions, we all know about them. These areas are in good shape. The pandemic is pretty much under control and there is no second wave at all. In other areas where there has been some, intrusiveness of politics into the public health work and the work of the healthcare system, then the situation is much worse and there are reasons to be concerned. But I think we're seeing what we're seeing now is also in many places better detection, cases with a younger age and a disease that is not so severe. So for instance, in our hospital and many other hospitals, we have many less cases, a much lower number of cases and less severe, which is no reason to relax, but is a reason to trust what is being done properly.
Professor, on the point about the severity of the clusters and the new resurgence and outbreaks in various places like in Catalonia, in parts of Germany, in Lisbon, the data seems to suggest that the fatality rate is lower and the severity of these case resurgences is lower. In a robust second wave, should we expect that the severity and the fatality rates will be lower than in the first wave? And if so, what do you pin that down to?
The severity, by all accounts, seems to be similar, low, always low, at around perhaps 1% of infected people only. The death, only about 1% of infected people will die, which is obviously low. But sometimes the figures may suggest otherwise, because we are testing more people, more asymptomatic people. So you cannot compare directly the death toll now and a few months ago. We must remain cautious because even some young people will die, may die, or will end up in the intensive care units. We know that. But we can be confident that the health system in many areas, at least in Spain with a universal health system, that the health system will be able to manage in many areas.